This is an example. This is what we want. Thank you. I appreciate it. Okay, if you'd please come on in and take a seat. Our speaker has an airplane to make, and when he starts talking with you, I think you're going to want every minute of the time you've got. Before I introduce the speaker for this program this afternoon, I'd like to introduce Dr. Yuzuru Kaneko. Dr. Kaneko, would you please stand? Dr. Kaneko came all the way from Tokyo just to hear this lecture. So the pressure is really on the speaker. Seriously, Dr. Kaneko is a faculty member, an associate professor of dental anesthesiology at the Tokyo Dental College, which is the sister institution of the University of Texas Dental Branch. He is here to spend today and tomorrow with us visiting different departments, but especially the oral and maxillofacial surgery department. Dr. Kaneko, we're delighted you could be with us, and we send our regards through you to all the faculty at Tokyo Dental College. I just completed having lunch with the speaker for this afternoon, and I am really impressed. I know you're going to be. Nutrition is something that we're all interested in, whether we know it or not. It plays such a big part in our life. Dr. William T. Jarvis has, at least the impression that I got spending the last hour with him, has developed an entire lifestyle or way of thinking around nutrition. He is a physical educationist by training in part, but he has done what all professional people should do. He has developed a philosophy. Well, yeah, I probably ought to say it the other way. He has related his profession of, of nutrition and health to a philosophy of life, to a religion of life, to a vocation of life, to a family style of life. He has not let one of these things overcome the other, but has brought them all together so that he really enjoys what he's doing. And I think I wish that all of us could do that, because then I think we would enjoy everything we do and not separate one thing from the other. I was quite impressed with his philosophy, and I know part of that is bound to come out in what he's going to present to you. He was born in Maryland and attended the Union College in Nebraska, where he obtained a Bachelor of Science degree and received a Bachelor of Science degree from the University of Minnesota, a Master of Arts degree from Kent State University, and a Doctor of Philosophy degree in Health Education at the University of Oregon. He's a member of the faculty of the School of Dentistry at Loma Linda University for several years, but currently is Professor of Health Education and Chairman of the Department of Public Health Science in the School of Allied Health at Loma Linda University. He's published widely in the literature and has made over 50 public presentations, including over 20 on radio and television. He has held many leadership positions in his profession, including serving as president of the National Council Against Health Fraud. And I emphasize that because I think that's part of the reason we're here today, to gain some better insight into, what is real health promotion and what is fraud. The entire American public during the last few years, even more so, has become concerned with physical fitness, exercise, nutrition, good habits of living. At the same time, we've been subjected to sophisticated marketing schemes for many food and health products. It is becoming increasingly difficult to separate health information from real food from fads or sound advice from quackery. One of the most qualified persons in the nation to speak on these issues is with us today. Please help me welcome Dr. William T. Jarvis.
Thank you, Dr. Allen, and it is indeed a pleasure to be with you here in the Lone Star State today. And since we've talked a little bit about health fraud, I want to share something with you that I think that a lot of you will appreciate. It's a rather contemporary notion of things, but can you see that well enough? I hope you can. The plaintive look on our quackbuster duck's face is complimentary of our graphics artist in the dental school at Loma Linda, and he's probably done more to promote the cause of anti-quackery than anything that we academics have done, because a picture is worth 1,000 words. I wonder if we could have the title slide on the screen. I'm going to put the lights down for you. Oops, how's that? Can you still see to take notes? Are you having trouble hearing me? You can hear me fine? Okay, I guess they can hear all right. Sometimes in the front you hear the voice more in the mic, and in the back you hear the mic. I've chosen the title Dubious Dentistry today. It's a title that I used in a chapter of a book that I helped put together a couple of years ago called The Health Robbers, which was a comprehensive book on the problems of quackery and pseudoscience and health. And what we're going to do is take a review of the current non-scientific dental practices and let me first say why I study these kinds of things, because it isn't too often that you find somebody in the academic community that studies non-scientific things instead of the scientific things. And matter of fact, one of the reasons for the proliferation of non-scientific practices is that many times you understand the scientific way to do it, but you don't understand what they're doing, and so it's difficult for you to critique them. One of the things that our Council Against Health Fraud has been able to do is to put together a network of individuals who do understand both sides of these issues and often appear as expert witnesses and are able to testify in some very important court cases along this line. Now, the reason I study these things is first that I'm concerned with health behavior, because being a health educator. And being a consumer health educator, I'm concerned with the health marketplace and how it affects that behavior, including commercial advertising. As a matter of fact, I've often said that all quacks are health educators, because they are all in the business of health behavior change just like I am. And I found, much to my chagrin, that many of the methods they use are also the same that health educators use. And I've often said that the thing that makes a quack successful are the same qualities many times that makes a good healthcare practitioner successful. The only difference is the legitimate ethical healthcare practitioner does not use those methods to exploit their patient, but rather they use them to enhance the effects of safe and effective procedures that they use that are scientifically based. Now, I've been teaching in the area of preventive dentistry for about 12 years. And in my work in preventive dentistry, I have come face to face many times with the anti-fluoridationist. And you might be interested to know that the same people who are fighting fluoridation are the same people that promote Laetrile, health foods, and other types of non-scientific health practices. As a matter of fact, during the Laetrile phenomena, a study done by the sociology department at Western Michigan University found that anti-fluoridationism was the best predictor of participation in the Laetrile movement. It tied for second as a predictor of Laetrile use per se. And then also another area that I specialize in is research design. I've been, for the last 10 years, teaching the graduate research design course in the School of Dentistry. And there we do deal with how do you design good research to answer questions in dentistry about the safety and effectiveness of procedures. And then I've also been teaching the undergraduate course in biometrics, which also deals with the evaluation and interpretation of scientific literature, not simply the learning of statistics, but learning how to apply research design, inference, and so forth. Now, I have a philosophy of teaching these courses that I think I learned something in my being in health sciences from the field of safety education. And you know, in safety education, for years they would teach good guidelines for safe behavior. But it didn't work very well because people still had accidents. It wasn't until we began to learn to teach about how accidents happened that people began to realize that there was a cause and effect relationship between their behavior and those kind of outcomes. I've applied that same psychology to the teaching of research methods. I think you have to teach bad science, what it is and why it is bad, before you teach good science, how good science improves upon that. And then from that you can go into actually teaching the practical application of research design. And so essentially that's what I've done. And in today's presentation, while we're going to focus a lot on nutrition, the problem of dubious dentistry, while I believe that the nutritional manifestation is the most common, has many other implications that underlie it that I think you have to have some understanding for in order to fully grasp the problem. So I want to start off with some pretty strange things. One of the things that I also have gotten involved in, because let me say that when you get into this area of pseudoscience and quackery, if a medicine man came to town in a medicine wagon, everybody would say, hey, that guy's a quack. But today's medicine men no longer wear top hats and strum banjos and run medicine wagons, medicine shows. Today they wear the frock of science, the cloak of religion, and the business suit of legitimate business. So I've even gotten into the area of the paranormal, and I chair a national subcommittee that studies paranormal health claims, psychic surgery, different kinds of alleged faith-healing miracles. And so we're going to have a little smattering from all of that today, because I think it does take all that. And the first maybe begins with the most bizarre, and it is what is called divine dentistry. And here we have a faith healer that goes around, and he doesn't just heal ordinary diseases, but dental diseases. Causes teeth to sprout, turns amalgam into gold, and so forth. Now, you know, sometimes, I've had this for some time in my file. I'm glad I had it, because, you know, when I run across these things, I say, that's so weird. Nobody will ever, that'll never be a problem. And then I find that the disciples of this particular fellow are now going around into fundamentalist churches and teaching divine dentistry. Now, sad to say, in this article, we have a member of the Board of Examiners in the state of California who made a non-critical statement about what she saw. She says, well, she didn't see any teeth sprout, but her teeth may be less sensitive now that she underwent this. Thank goodness when the head of our dental society went and saw this fellow work, he wasn't quite so naive. When he looked in people's mouths and saw no amalgam turning to gold, the faith healer said, oh, it doesn't happen immediately. But the transmutation to gold occurred now and will continue, and in 3 or 4 months these amalgams will now be gold. And of course all you have to do is find this person and check it out, which of course no one bothers to do. Here is a piece from one of our dental society journals. We have a person doing implants here under pyramid-shaped object in the ceiling. And maybe if we could just slightly improve the focus on that. Says that this fellow is looking at this pyramid power. There we are. He says, to date, observations have been encouraging that pyramid energy, sometimes called bioplasmic or biocosmic energy, serves to repel bacteria. And so he goes on to talk about how good that is. Well, pyramid power probably has run its course, but it really hasn't. It only appears to. Maybe you don't find it in the news as much, but it's part of a much bigger picture. For example, this is from a Holistic Health magazine, and it talks about that this Atlantean crystal was found in a massive pyramid in the Bermuda Triangle. And it's a unique crystal ball. But what is there about this shape that is so important? And you even notice it's repeated here in the circle. Well, there's a thing called the sacred or occult geometry. And as you go back into history and study the development of numerology and the idea of Pythagoras, matter of fact, Pythagoras believed that the perfect number was 12. I know you hear the perfect number was 7. That's really not so. The numerologist said the perfect number was 12 because a cube, which was the symbol for Earth, had 12 edges. And they thought this was the perfect shape, being a perfect three-dimensional cube, and that this number was important because if you take a string and put it under tension and then begin to pluck it to get musical sounds, the number 12 is the only whole number that is divisible into each of the points on the string that make harmonious sounds. And this brought in a whole concept of the music of the spheres, and that there was a whole interrelationship of all things. And that's sort of the beginnings of the occult geometry. But in this process, fire having a pyramid shape was thought to be particularly miraculous, and fire was once held in the temples as the greatest gift of the gods to man, and I think you could understand why. In a cold morning, or wanting your food cooked or anything else, how important fire was. But that's sort of the long time ago history. But more recently, this has been revitalized under the concept of the existence of an anti-gravity force. Just as gravity pulls inward, the anti-gravity force works outward. And the way they pose it, they say, you know, Sir Isaac Newton was sitting under the tree, the apple hit him in the head, and he said, aha, gravity. And the question is, how did the apple get up there in the first place? Well, because of the anti-gravity force, the outward force. The theory is that this force follows what are sometimes described as ley lines, and that crystals form along these ley lines, because when crystals form, why is it that the lines form where they do and the crystals form where they do? Pyramids are half crystals in shape, and of course the Bermuda Triangle is pyramid shaped, and wizards wear cone-shaped hats. Now, so do dunces, I would like to add to that. Dowsers, people who do water witching and so forth, and that's probably the most common manifestation of this whole concept, which is also known as radiesthesia, that the pendulums and water witches are aided by the force. That's what's moving the wand. That really is not true, but we don't have time to go into that. Talismans, scepters, and amulets affect this force. Earth faults follow ley lines. Magnetisms follow ley lines. Storms, winds, and ocean currents are affected by it. The force may affect the northern lights, people's auras, you know, when people read your aura. Bird migrations. In other words, almost any mystery you want to come up with, you can attach to this system, which is, if you'll notice, is kind of what they're doing here. Radio waves. Angels travel by this force, and this force creates planets, galaxies, comets, and other heavenly bodies. And what is needed is an Einstein to present a unified theory of these phenomena, and we will all change our entire worldview, just as Einstein's theory of relativity overturned Newtonian physics early in this century. The physicists are anxiously wondering if somebody else will do the same thing to them again. And I often like to chide the physicists as never having recovered from Einstein's revolutionizing Newtonian physics, and they're saying, just as we thought we had it, somebody came along in just a mere 150 years and changed it, and we've only believed that now for 80 years. Who knows when somebody will come and change it again? And there's sort of a hand-wringing that goes on there. Well, here's an interesting object. One of our dental patients came to the clinic wearing this amulet around her neck that had been sold to her by her dentist for $85 for the purpose of curing her gum disease. At nighttime, when she was unable to wear the amulet, she was supposed to put it back in its box and have the reflector aimed at her. And with it, she took a food supplement called the Total Food, which was part of the divine diet. Now, this illustrates better than anything the common ground of nutrition that seems to fall into all of these different systems. Because if you look at his divine diet, here he says the 21 highest energy foods, and he has the energy asterisk, and it says we do not refer to calorie energy. What kind of energy then? Cosmic energy. And it's typified by this crystal, which you'll notice the triangular shape, which is really what was inside of the amulet, and was allegedly vibrating at the proper vibrations to attune her cells to the proper vibrations, which would result in health. Now, I'm going to use as my format the Holistic Dental Association, because this is an organized group which really promotes these unproven concepts in the name of holistic health. And let me say that the concept of holistic health is a sound concept. It's a concept that I have been schooled in, that indeed is the basis for Western thought, and that is that there is an interaction of physical, mental, spiritual factors and the social interaction of people. And in order to deal with people and to meet all of their needs, we have to deal with them on this level. But the reality is that the word holistic health is redundant, because the word health has as its root the old English word hal, from which we get hail, health, holy, and whole. And to say to make man whole, which is the motto of Loma Linda University, literally interpreted means to make man healthy. In other words, health is wholeness and implies physical, mental, spiritual, and social. And so to say holistic health is really to say health. But what has happened with this, and of course there are some positive aspects of this, we have emphasized in the area of the holistic concept the idea of integrating one's total worldview and taking into consideration one's entire environment as we look at a person, which is totally consistent with the way Hippocrates taught and with Western medical model. In doing this, many specialties have developed, and it's true that because of specialization, that sometimes we tend to fragment too much. And there certainly is a need to call ourselves back as practitioners to say, while we treat only the specialty of dentistry, we do need to take into consideration the whole person. We need to take into consideration their psychological, the sociological needs, and so forth. But the people who have coined the term and now gone into the marketplace with the term holistic health are really using it as a marketing term. And as a marketing term, they are using it as an excuse to promote scientifically unproven procedures. Because they like to say, well, science is reductionist. You know, you reduce people to their parts rather than their wholes. And since we use holistic methods, we can't do that. We can't test them scientifically. And yet, I like this little joke about acupuncture, which shows that when you decide to treat a person, the method that you use is no more holistic than any other method. That as soon as the procedure becomes specific, those important clinical questions of, is it safe and is it effective for the condition for which it's being applied, can be answered. You can ask if it works better than doing nothing, the natural history of disease, appearing to do something, the placebo effect, or is it better than some standard procedure that we're already using? Because in acupuncture, it was found in dentistry that there was a certain amount of acupuncture anesthesia, but it didn't work better than the procedures that we were using, and it didn't have any other advantages, and therefore it never really quite caught on. Now, as we look at the overall list from holistic dentistry, we see that they list 19 different disciplines, and some of them you'll notice: endodontics, general dentistry, and so forth. Orthodontics are standard, but there are some up there that you may have had some knowledge of, such as acupuncture, but others may be rather strange to you. I'm not going to have a chance to look at all of them, but I'm going to look at some, I think, what are significant ones. Acupuncture, for example, which I don't think we need to review the history of that and the philosophy. The way it's applied here is to use what's called electroacupuncture according to Voll, or EAV. Now, what this is a device that essentially, it's called the Dermatron. Now, the Dermatron does not conform to the federal device laws that require safety and effectiveness to be established. It is an illegal device to use in your practice in the United States. Dentists go to Germany and bring this back in the trunk of their new Mercedes, and when they get back to the office, use it to help pay off the Mercedes, I guess. But the way they apply it is as this fellow is doing. The patient holds an electrode in one hand while he goes over the alleged acupuncture points with the other hand. And let me say alleged because, quoting from the Medical Tribune, May 2, 1984, at the 1983 International Conference on Acupuncture and Chronic Pain held in New York City, these statements were made. Acupuncture points do not exist. And there are so many acupuncture points that there is no skin left on which there is not an acupuncture point. So these things have no validity. Now that doesn't mean acupuncture doesn't have some usefulness in the control of chronic pain, because it does. But that's quite a different area, and like I say, we won't have time to elaborate on that unless during the question and answer somebody wants to bring it up. But now, based upon then these points, the person makes certain diagnoses and prescriptions. Now, let me say that here's the way they do it. They read the device, the gauge, and a reading of 50 is considered to be normal. Below 50 allegedly indicates degeneration, while over 50 means irritation, and if it goes above 82, it means inflammation. Now, the critics of this technique say that even subtle changes in pressure of the probe greatly affects the reliability, and also moisture on the skin does too. And yet these subtle changes are not taken into account by the practitioner, but rather he subjectively does this and then prescribes what are called homeopathic remedies on the basis of the readings that he gets. Now, before I talk about homeopathy, I want to talk a little bit about Voll's theory of some kind of a bioelectronic activity going on in the cell. Now, we know, of course, that the body emanates electrical impulses. I mean, electromyography is well known. In the area of neurophysiology, these things have been well studied. But this concept really goes back to a concept called radionics, which was at that time known as ERA, the electrical reactions of Abrams. Albert Abrams has been called the dean of medical quacks of the 20th century. He was a medical educator in a medical school in San Francisco, and really quite a genius in his own right at one time, and came to believe that all life is vibrating, and of course we know that there's a certain truth in the physical world about that too, but that in fact health and disease had different kinds of vibrations emanating from cells, and that he can in fact deal with it. Now you can see here's his theory. All matter's in a state of vibration. Everything has its own wavelength or frequency, just as a radio station has. These can be turned into tuned into for diagnosis and treatment. A specimen is required, meaning urine, hair, skin, nail trimmings, blood secretions, fecal matter. Actually, he could even use your signature or a picture of you. Even got to be that any personal object could be used. And later on, a chiropractor by the name of Ruth Drown developed an elaborate console where she said she could reach you by radio and treat you anywhere you were in the world. And she sold small devices for people to treat themselves, and in fact had quite a following in Hollywood, which isn't too hard a place to get a following for quacks for some reason or the other. You have to understand Hollywood personalities a bit, I guess, to fully appreciate that. But I have a museum of quack devices that includes one of the Drown devices that was owned by the mother of the great late Tyrone Power. And when Ruth Drown died in 1965 while under indictment for fraud, it came as a disappointment to me to discover that she had cancer and was being treated by the regular physicians using conventional methods, because I thought at least she should have the decency to use her own system to try to cure herself, because Abrams actually died during his trial too, and at least was found that he was using his own methods. But that's always a question, are these people frauds or just what's really going on with them? But at any rate, Abrams developed the oscilloclast, which was the original black box. You heard of black box quackery? Well, this is where the name came from. It was from his oscilloclast, and this is one of my many oscilloclasts. And it's supposed to, again, tune into your vibrations and also be able to alter your vibrations. And his evidence, I have a copy of his original book, and it's interesting to read his evidence. And it's strictly on an anecdotal basis that he found a person with cancer, and as long as the person faced north and had his arms raised, that it didn't work if he was facing anything but north. Now, sometimes they had to face west, and then that was only under certain conditions. And you get into this maze of anecdotal reports that he gave about how he found this cancer patient got this kind of reaction, therefore all cancer patients will get this kind of reaction. And it's a very strange sort of thing. And Abrams was not the first to believe in the importance of electromagnetical forces in health and disease. In fact, by the way, this is what we call selective affirmation, where a person finds those cases that seem to fit the model and then uses that for their basis rather than using objective double-blind kind of procedures. And this is where, in the area of research methods, we say, look, his intentions may have been good, but his methods were bad. He fooled himself because his desire to affirm his beliefs outmoded his objectivity. Well, here's a book that I have. I'm sorry it's not quite on the screen, but it's a book on static electricity. And I want you to see how this can work, because there was a belief for a while that static electricity, indeed the same kind of thing that happens when you go across the carpet on a dry day and get a spark when you touch something metal. This is what's intentionally generated by this kind of a device. And then the patient sat on this metallic grounded piece of material, and then using in those days gaslight, they would touch him in different points and get a spark. They also developed what they called the static breeze, where in this case they didn't even touch the patient, they merely held this electrode in front of their face and showered sparks toward them. Now, as you read the book, it's just full of reports like this, and I'm just, in the interest of time, we just have one. This was a woman with chronic tuberculosis. 25-year-old woman had a cough for 2 years. In this case, well, let's see, we'll drop down. All right, a spray with a few mild sparks across the upper region of the chest immediately increased her power of deep respiration and removed the chest pains. All you had to do was shower sparks toward her. And she had only occasional night sweats, and these ceased. All symptoms except the cough were entirely relieved at each treatment and returned the next day with less in severity. This woman was treated for 2.5 months, 3 times a week with some irregularity. When she got a little better, she would dance half the night or go on a shopping expedition. I guess women hadn't changed that much, I guess, huh? Or do a hard day's work. They're still doing that too. And then cool off in a draft. Her relapses kept pace with her imprudences. In other words, every time she had a relapse, he could find something that she had done that he could blame it on. And this is classic as you go through and read these different cases, and it's really quite typical of the time when this kind of empiricism was used. No objective testing, but simply looking carefully at each case. Every time something went wrong, finding a rationalization for why it went wrong. Every time something went right, taking credit for it. And like I say, that is the kind of the bad science one can fall into. Well, turning now to homeopathy, which the EAV machine is used to prescribe medicines for. Homeopathy is a principle based on treating similar with similar, using highly diluted preparations. And let me say that the history of homeopathy goes back to this fellow, Dr. Samuel Hahnemann, who in 1810 came up with this concept. And the reason he came up with the concept of homeopathy was he lived in a time that's been described as heroic medicine, back when doctors used to bleed people and purge them and puke them and do all kinds of very drastic kind of things in order to balance the 4 humors that Hippocrates had elaborated in his theory of disease. Now, people were being killed. It was obvious that, the great story of George Washington and how his physicians killed him was classic at the time. And Hahnemann said, something's wrong here. So he went back and he looked at the history of medicine and the philosophy. And he saw that Hippocrates had introduced a concept called allopathy, or what is known as allopathic medicine. The concept of allopathy said that in order to treat people, you look at their symptoms and then give them a treatment that would elicit the opposite kind of symptoms in a normal, healthy person. And now, if you remember the Greek 4 humors of earth, air, fire, and water, they were also 4 conditions: hot, cold, wet, and dry. In fact, the Greeks had everything divided up into 4. That's why I think we have 4 seasons of the year, 4 directions. There's much of that is still part of our culture today. Because, see, the Chinese medicine had 5 elements, and they have 5 directions. They have north, south, east, and west, and center. If we had had 6 elements, we'd probably end up with 6 directions, because if you took a compass, you could divide it up 6 ways as well as 4. I mean, there's an awful lot of the residual of those philosophical ideas that still exist in our culture today. But at any rate, in the idea of treating opposites, Hippocrates said if a person is hot, they have a fever, you should give them a treatment that would cool or create chills, if you please, in a normal, healthy person. If a person has the chills, you would do the opposite. You would give them something that would warm up. If a person's constipated, give something that would produce diarrhea. If a person has diarrhea, give something that would constipate. Well, I think you can see that even today there's a certain amount of allopathy that is practiced, not on the basis of the philosophical model of Hippocrates, but on the basis of rational science today, because that's only one source of where medical procedures come from. But as Hahnemann looked at Hippocrates' writings and how they had changed, the important thing that he had done was to, first, he got rid of the notion that the gods caused disease. In fact, he said disease was a natural, not a supernatural phenomenon. That's really why Hippocrates is thought of as the father of modern scientific medicine, not because of his system of healing. But prior to Hippocrates, they believed in this law of similia that Hahnemann rediscovered. In the law of similia, we'll see more on this as we go on, but it said essentially you treat like with like. They used to, when a warrior that was wounded with a spear, spear scrapings were put in the wound, because since the spear made the wound, the spear had to participate in its healing. It's a little bit like the hair of the dog that bit you concept. The person, and by the way, homeopaths use that as evidence, empirical evidence, that they are right. That a person who wakes up from a drunk and their mouth feels like, since I've never woken up for a drunk, they tell me your mouth doesn't feel too good, like the bottom of a bird cage, I think someone has described it as. Taking another drink relieves that. Now, since I teach in the area of drug abuse, I can see how what a person is doing is coming out of this depression and getting into the shakes, and then takes a depressant and gets back toward normal again. And that's kind of the same rationale. And they like to claim that immunizations is based on that, when in fact it isn't. Because Hahnemann said not only does this law of similia exist, but in order to decide what medicines were good for what then, he did what he called provings. He began by taking quinine, which was a then known medicine for malaria, and noted that he got symptoms similar to malaria when he took too much quinine. Since quinine treated malaria and produced the symptoms something like malaria, and there's always a lot of subjectivity to symptoms, as you know, but he said since they did this, that this meant that you could match medicines by the symptoms that they created. So then he would go through all kinds of different substances, taking them mostly himself, recording the symptoms, and then trying to find what diseases fit those symptoms, and then saying, now this is good for that disease. His concept of similia said then that if you have fever, give something that produces fever. If you have diarrhea, give something that produces diarrhea. If you have constipation, give something that produces constipation, based upon these provings idea. Well, now you say this guy is going to hurt somebody if he starts really practicing that. But he also developed what was called the law of infinitesimals. And that is because of the way the body worked. When it was sick, it worked different than when it was healthy. It became more sensitive. Therefore, the smaller dose you gave, the stronger it would be. So he came up with this law of infinitesimals, and what he would do is start diluting. Once he had discovered these medicines, then he would dilute them by the powers of 10. And if he got down to, let's say, a homeopathic remedy that has a 6x next to it, it means essentially it's a power of 10 to the 6th power, which means a 1 to 1 millionth dilution. And if you got down to a 12x, which is really potent in his way of thinking, it would be 1 to 10 to the 12th power. You can imagine all of those zeros. And then he also developed the idea of potentizing. If you shook them up and tapped them, and shake and tap, and shake and tap, you would double their dilution. And now a 1 to the 12th power would be 1 to the 24th power, which according to Avogadro's number, none of the original molecules even exist anymore, and it's really powerful. Well, that developed, a whole pharmacopoeia developed around it. And the fact was that what he was giving was distilled water to people. And since he wasn't bleeding them and purging them and doing all those, giving them calomel and the poisons that many of the physicians of the time were giving, in fact, he wasn't killing anybody. And he was doing better than the physicians around him, and homeopathy took off pretty well. Matter of fact, I have a joke here from the Law of Infinitesimals. This is a caricature it's a 19th century caricature of the homeopath's infinitesimal doses. It says, I should like 100,000th of a decigram of magnesia, please. Says, I'm sorry, madam, we don't carry such large quantities. I mean, these things were really diluted. But in time, of course, as medical science became a science, later on in the 19th century, homeopathy began to recede. And however, in recent times, homeopathy is making a comeback. Here is an ad for Natrobio homeopathic remedies, and then the script goes on to tell you about what I've just told you about. And the fact is, these substances are legal. The FDA says there are 60 companies now engaged in the marketing of homeopathic remedies. Why? Because in 1938, when the 1938 Food, Drug, and Cosmetic Act was passed, a then Senator, Royal Copeland, who was the foremost homeopathic physician of his day, saw to it, used his political influence to be sure that the homeopathic pharmacopoeia was included in the 1938 Food and Drug and Cosmetic Act. He didn't get a whole lot of resistance because homeopathy was pretty much dead in this country by that time. By the way, it remained alive in Britain and India. And the Queen of England has always had a homeopathic physician and regularly takes homeopathic medicines, and Bonnie Prince Charles is a great advocate of homeopathy. And of course, as long as you're young and healthy, it doesn't matter what you believe. But if you get sick and you rely upon distilled water, you're liable to come up short. But at any rate, because of this inclusion in the pharmacopoeia, homeopathy is now legal and is being marketed. And we do have to say it is harmless in and of itself. But if it's used as a substitute for effective medicine, there's apt to be some problems because the tests of homeopathy have not been, there haven't been a whole lot of tests because homeopaths accept the effectiveness of their remedies on faith. But where there have been tests, it has come up short. Now, another thing that the Holistic Dentistry booklet mentions is chiropractic. It talks about it being a system of diagnosis and therapeutic procedures based upon the normalization of the nervous system and human biofunction. I did my PhD dissertation in chiropractic, and I'm very interested in this because it's a wonderful model of pseudoscience in our society today that is actually licensed by the state. And as a matter of fact, chiropractic is licensed in all 50 states, which is used as chiropractors to imply its recognition of its validity. The fact is, it is a legal recognition, and it is done for regulatory purposes, and was done originally to keep chiropractors from prescribing drugs and doing surgery, because they felt if they didn't do that, at least they wouldn't produce much direct harm. Now, in all fairness to chiropractors, let me say that chiropractors generally are excellent manipulative therapists. When it comes to their ability to manipulate, it's just like the difference between the ability of different dentists to practice dentistry or different surgeons to practice surgery. It comes down to the individual as to how good they are. But since that manipulation constitutes the vast portion of their training, and manipulation takes a lot of hand skill, these are generally the most or the best trained and experienced and skillful manipulative therapists in the community. However, the uniqueness of chiropractic does not lie in the fact that they manipulate, but the explanation they give as to why they manipulate. And this can be seen in the basic subluxation. This is from one of their patient education brochures, which shows a vertebrae out of place and an impinged nerve. Now, they would say that's exaggerated because, in fact, they don't get that far out of place. But they do impinge nerves, they say, even though it's been shown that this really doesn't happen. If you have a pinched nerve, you'll be very much aware of it. But what they're talking about are pinched nerves that you won't be aware of, that somehow, now because of that pinched nerve, as this slide shows, will cause you problems. Now, if we could have the focus sharpened on that a little bit, please. Here they say a slight pinching of the nerves in this point can indicate certain disorders, ear or eye disorders, ear problems, insomnia, abnormal blood pressure, colds, hay fever, sinus trouble, nervousness, wry neck, arthritis, colic in babies, glandular trouble, etc. If it's here, it can cause neuralgia, pain in the shoulder and arms, goiter. Bet you thought goiter was iodine deficiency. No, it's nerve interference. Nervous prostration, whatever that is. And then here it can cause rheumatism, neuritis, bursitis. Here it can cause fast heart, nervous heart, asthma, difficulty breathing, bronchial congestion. Here it can cause pleurisy. Pleurisy and other problems. Nerve pressure here can cause gallbladder, dyspepsia, gas of the upper bowels, shingles, which as we know is a herpes disease, hiccups, certain kidney problems here, eruptions of the skin, In other words, they go on and on. I have tables that show practically every disease you can imagine, and then at the bottom it says if your disease isn't on here, see your local chiropractor. He'll figure it out for you. And so most people don't realize that chiropractic is that inclusive. They think of chiropractors as manipulative therapists that reduce musculoskeletal back pain, and in fact they aren't too bad at that. But the chiropractic theory goes much beyond that and says that they can treat all kinds of conditions by relieving this nerve force. Now, not all chiropractors limit themselves to manipulation. Many that are called mixers are actually naturopaths who really perform eclectically, which means they take a whole variety of ways of approaching their ideas of disease other than to use surgery, drugs, and in fact scientifically valid methods. Because I have a diploma in naturopathy, and in my studying of it, I wanted to see what in the world these people really believe, because it was the most difficult thing to try to find some kind of a central unifying theory. And essentially what it is a collection of all kinds of old-time theories, like they're big on colonic irrigation, which is based upon the concept of auto-intoxication, that the gut was a source of focal infection that's caused the body's all sorts of diseases, and they're going to give you colonic flushes. And they have they'll get into acupuncture, they'll get into reflexology, iridology, reading the iris of your eye to make diagnosis, almost anything under the sun. But the one thing that they don't do is ever test these ideas scientifically. Rather, they use that same kind of selective affirmation, that empiricism that says, well, if it works, that must have been the good thing. If it didn't work, there was a good reason why, and they can rationalize it away. Another thing they do in holistic dentistry is called cranial osteopathy. And now this is something that is not... Now, osteopathy also began as a 19th century cult, believing that all diseases were caused by displaced bones. Only they didn't believe that the displaced bones interfered with nerve interference like the chiropractors. Rather, with them, it was interference with the circulatory system, the body fluids, blood and lymph. And if you got the bones right, the circulation would be right, and the body would be right. It's called the rule of the artery versus the rule of the nerve, it's been called. But now this cranial osteopathy is not advanced by legitimate osteopaths, but rather fringe osteopaths that say that the skull bones have a certain amount of play in them. And he says through cranial osteopathy, the patient can have his cranial bones freed up for proper functioning of the head and thus the entire body. So they give you a little bat on the side of the head, and that's supposed to get your skull bones right, and everything goes well. Chiropractors also engage in this practice, and here's an ad in one of our California papers for what he calls craniopathy, which is a new word for the same thing, a natural method of health care. Kinesiology, which is also was invented by a chiropractor, George Goodhart of Detroit, who, by the way, was the first chiropractor ever appointed to the U.S. Olympic team in 1980. It was the defunct team that never went to Moscow, but he was the official chiropractor for the U.S. Olympic team, which was a first. And this is used by non-scientific practitioners, not only chiropractors, but others. And the word kinesiology, kinesiology is a legitimate science. It's a study of muscle movement, and when I took my degrees in physical education, I had courses in kinesiology. But it wasn't applied kinesiology. They sort of borrowed the term. And the idea, of course, is that through muscle testing, you can tell a person's health status and prescribe medicines for it. Here, this particular chiropractor, who's from Tucson, Arizona, says that George Goodhart of Detroit has learned how different muscles of the body respond to various nutrients. But he also has learned that it's possible to detect cancer quite easily through a simple test of muscular resistance performed by the doctor and a patient in a matter of minutes. So here he's testing this person for cancer. This particular individual recently lost his license to practice chiropractic and naturopathy for 1 year because of the determined needless death of a cancer patient who actually came to him for his natural therapies. And the broad consensus of opinion was that her life would have been spared had she sought conventional treatments. But this method of muscle testing has been used not only to detect cancer and various nutrients, but what kind of music you should listen to, what color you should paint your room, and almost any other kind of... There's even, matter of fact, Goodhart himself wrote that some people think you can find your star in the heavens, you know, your star. by pointing to different stars and having your muscles tested until you get one that tests strong, and then that's your star. Even Goodhart expressed some skepticism about that. Well, much to our dismay, in the 1981 scientific session of the American Dental Association, we had a dentist doing TMJ evaluations based upon muscle testing. An unscientific method. And by unscientific, it means it had not passed the muster of any kind of scientific scrutiny, and yet the American Dental Association saw fit to put it in a scientific session, which made us wonder a little bit about the scientific acumen of the people planning the scientific session. Because while we really don't object to the presentation of these kinds of unproven procedures, because in my research methods class, indeed, I have people come and demonstrate these before my class so we can look at them, evaluate them, and figure out how they should be tested. We sort of regard this as sort of a Hyde Park kind of forum where any idea can be presented in this forum. And I believe in that. But before you give somebody the status of a national scientific assembly that they will then use to sell that once they get away from there, I believe that they should pass certain minimal scientific standards. Because the fact is, there was one of the first studies ever published on this was done at the University of Texas Dental School at Austin, where they used dental students, testing them with sugar. And of course, 3/4 of them tested weak with sugar until they told them that the sugar would give them quick energy, then they tested strong. Because what is really at work here is suggestion. And there, in fact, was a chiropractor, to his credit, who did double-blind studies on nutrition and found that when you don't know what it is that the person is giving you, you get completely random responses using this technique. Now, again, we see the kind of rampant empiricism and selective affirmation, because I know one of the tests that we did, our Council Against Health Fraud also did some tests at Stanford University on this. They substituted a block of styrofoam for a sugar cube because they looked a lot alike. And after the person tested a week on the styrofoam and then was told that it wasn't sugar like they thought it was, the practitioner said, well, I guess they're also allergic to styrofoam. So, you know, that's, you can always find a way of explaining away the failure. But at least, like I say, there have been, every test that I have seen done, which have been many, is that you get random responses under random conditions, and you get expected responses when suggestibility is allowed to function. Now, this is the way we see it in dentistry. The tooth muscle chart shows that there's supposed to be a correspondence between certain teeth and certain muscles. And indeed, there are certain teeth that are not supposed to be removed by orthodontists lest they destroy one's running ability. And in fact, there have been charges made that orthodontic procedures have ruined the careers of world-class runners because they have removed the tooth that corresponded to their running muscles. Now, I haven't seen anybody sued for malpractice on that yet, but I'm waiting. Now, here's a table that comes with this tooth muscle chart. And over here, you notice they have a list of muscles. They only have 40. I don't know what they did with the other 500 and some, but there are 40 of them there. Organs, nutritional alternatives, teeth, and acupuncture meridians. And what they're saying is that if you get weakness in this muscle, it's because there's an involvement in a particular organ, and that it's related to this particular tooth and meridian, and this is the supplement that you should be testing. So they'll have them hold or this particular supplement until they get a strong test. Well, now, when you think about the myriad of relationships, the potential, I mean, when any one of those theoretically then could be related to any other one scientifically, it means you're going to have to test every one of these against every one of these, and the combinations of mathematically are astronomical. And it obviously would take a number of lifetimes to do all of those tests. And so I asked this proponent of dental kinesiology, I said, how did George, chiropractor Goodhart, arrive at all of these relationships? Because how did he manage to do all that research? Because he's not that old a man, I don't think. Oh, he says, George didn't test these scientifically. George is a psychic, and he arrived at them psychically. So if you believe in psychics, much less if you believe in George as a psychic, I guess they're acceptable. And then, of course, I think one of the most revealing is what they call the life force or spiritual discipline. Life force is the bioenergy, which is sort of a circular bit of terminology because biology is the study of life, and which is bio and life are similar, and force and energy. So we have kind of just a substitution of words here that doesn't really enlighten us anymore. But it holds everything together and allows life to flow in a natural and balanced way. This life force exists on whatever level of consciousness we operate and is the basis of all human understanding and action. By keeping this force in balance, the patient is in tune with natural laws which help him avoid energy drains and cause illness. Now, when we see life force, now we're beginning to get into the metaphysical dimensions of this whole thing. And as you go back into the history of medicine, you'll see a concept repeating itself called vitalism. And vitalism, which is described here, it says that the essential element of life can never be explained mechanically. Only nature can put molecules together in the proper fashion needed to maintain life and health. Nature is thus viewed as mystical and metaphysical, which means beyond the physical, beyond the observed, beyond the measurable. Now, this view largely pervaded Western thought and was the subject of many philosophical debates until 1828, when a chemist by the name of Wohler synthesized an organic chemical compound, urea, in a test tube, and for the first time created an organic chemical compound without a dog or a bladder, but did it with inorganic substances, and actually introduced the age of organic chemistry. It was later verified and advanced by Claude Bernard, who showed that the human body was not only capable of catabolism, breaking down chemical substances, but anabolism, building them up as well, and that these could also be duplicated. And so vitalism has an ancient history, and people who are known as vitalists still cling to this sort of mystical view of life and will indeed say, well, then what is life? You know, science has not yet found the secret of life. And while that may be true, that does not automatically mean that it is metaphysical, or that we won't, or that you can explain these in terms of some ancient philosophy of yin and yang, or one of the other concepts that are used by these people. As a matter of fact, here is a table from a book on the holistic healers which shows that this concept is central to most belief systems. Hinduism calls it prana. Taoism and Chinese medicine calls it ki. The Polynesians refer to it as mana. American Indians as orinda. Mesmer as animal magnetism. Palmer called it the innate, and we'll see a description of that in a minute. Reich, orgone energy. Hahnemann, vital energy. Von Rickenbach, the odic force. Contemporary Soviet parapsychologist, the bioplasmic force, and even the concept of ESP, mental telepathy, and this kind of things is also explained in this way. And in Star Wars, it was called simply the Force, and indeed even UFOs are connected with it, and somehow the occult geometry that we took a look at. Well, let's look at some of the descriptions that we get from at least, we're going to look at chiropractic and homeopathy. This is from a chiropractic textbook. So the founder of the science of chiropractic appreciated the working of universal intelligence. By the way, this man was a grocer in Davenport, Iowa, who had no medical training, but was a phrenologist who felt the lumps on your head to read character, a mesmerist, believed that by laying on hands he could transfer energy to people and heal them, and a spiritualist. So he dabbled in all kinds of metaphysical ideas. And when he cured a man he believed of his deafness by manipulating his back, he believed he had found the cause of all disease. But the function was this. He says the working of universal intelligence, capital letters, which he meant as God, and the function of the innate intelligence or soul, spirit, or spark of life within each, which he recognized as a minute segment of the universal, and the fundamental causes of interference to the planned expression of the innate intelligence in the form of these mental, chemical, mechanical stresses, which create the structural distortions that interfere with nerve supply. Because you see, when you actually do impinge a nerve, what happens to the nerve impulse can be measured by neurophysiologists. What happens is that the nerve impulse moves more slowly through the zone of impingement, but resumes all of its normal characteristics once it reaches normal tissue. Therefore, when pressed on the notion of spinal impingements affecting health and disease, and you ask the chiropractor, in what way does this affect health and disease, they are forced to fall back on the flow of the innate life force, because it's nothing that can be measured in mechanistic terms. And indeed, when Creelan of Yale University showed, by using cadavers, that you had to put the spine in a drill press and put in over 2,000 pounds of pressure to create enough of an impingement to actually pinch a nerve, the response of the chiropractor was, well, he was dealing with cadavers and the life force is gone, so you can't learn this on cadavers. Hahnemann, according to a homeopath in England, 1982, says Hahnemann is a child of the modern age of natural science, an adept of the chemistry of his day. Remember, we're talking 1810. But he can still hold a conviction that an immaterial, vital entity animates our organism until death when a purely chemical forces prevail and decompose it. This vital entity, which he characterizes as immaterial, spirit-like, and which maintains in health the harmonious wholeness of the organism, is in fact the wholeness of it, can be influenced by dynamic causes. How does he clarify it? He draws attention to phenomena like magnetic influences, the moon and the tides, infective illnesses, and perhaps most importantly, the influence of emotions and the impulses of will. So again, we see this metaphysics is really at the heart of these things. And this is what gives these movements their dynamism. This is why they're able to accept on faith the theories rather than validating them through some kind of scientific procedure. And then turning to nutrition, the way they state their nutrition discipline says nutrition is the science of balancing body chemistry and providing the body with proper levels of fats, carbohydrates, and so forth. Let me say that in dentistry, this term, balancing body chemistry, has become a catchphrase that can almost be used as a way of spotting food faddism in dentistry. When I hear a dental practitioner saying, we have nutrition in our practice, we balance body chemistry, so far they have universally been a part of the food faddism that is well traceable within dentistry. And I want to trace this for you because it's got a very significant history, and it begins, and a good place to start is with the Price Pottinger Foundation of Santa Monica and Granville Knight, MD, its president. Now, looking at Granville Knight, if we look at the June 1970, the American Dental Association Journal published a section on comments on the opponents of fluoridation, and it profiled various individuals, among which was Granville Knight. And here was the beliefs of